meeting. Unfortunately, it's another virtual one. Soon, we hope to be able to gather in person. My name is Bob Borden, and it is my honor to be the co-chair of the Community Wellness Council, along with my partner, Heidi Vanderhorst. Now, you notice I was just pausing as I said a name, because we have with us two American Sign Language interpreters, and they will be spotlit on your screen along with a slide deck. So a very warm welcome to Jennifer and Andrew. My community, my health, my resources very clearly articulates what today's program is about and what the mission is of your Community Wellness Council. We hope that today's program will provide you with current information about the state of our healthcare in Dufferin and Caledon. Before we go too far into the program, you should be aware that this program is being recorded to be put on our website. So if you have concerns about being seen on camera, perhaps you should turn off your camera. At the outset of today's meeting, the Community Wellness Council Core would like to acknowledge and sincerely thank all of our healthcare workers, our PCWs, our EMS personnel, who on a daily basis, no matter the weather or the pandemic, continue to provide the citizens of Dufferin-Caledon with top-notch service and care. A big thank you. Your Community Wellness Council is an integral part of the Hills of Headwaters Collaborative Ontario Health Team. Your participation today and in the future will ensure that the voice of the patient, families, and caregivers are kept central to all decisions that are made about our local healthcare system. So let's see what we've got in store for you today. Heidi, can you put up the agenda, please? So as you can see, we have a very full agenda this afternoon. We have two representatives from Peel Public Health, Doctors Sundarji and Gurtu, who will be talking about vaccinations and testing. We have three presenters to talk about mental health. Maureen from the Dufferin Area Family Health Team, Tim from the Canadian Mental Health Association, and Catherine from the Dufferin Child and Family Services. We also have Natalie, a social worker at Bethel House Hospice, to talk about advanced care planning. We'll have an update from Alex Lim on the status of our Ontario Health Team. And finally, we'll have a presentation on the Caregivers in the Hills program with Dini Demakos-Shevchenko. All of you will be muted during these presentations, so if you have any questions during a presentation, just go to the chat room at the bottom of your screen and post the question. We will have 4 people monitoring it, and if time permits, we will answer them this afternoon. If not, we will be sure to post the information on our website. Before we start, just a note to our presenters, we're on a tight timeline this afternoon and we have lots to cover. So I'll be giving you a 2-minute warning to start wrapping up your presentation. So at this point, I'm going to turn it over to Doctors Sundarji and Gurtu. Welcome.
Hi, everyone. Thanks for having us today. I'll let Dr. Gourd to introduce herself. My name is Dr. Leah Sunderji. I work full-time in the emergency department as a pediatric emergency doctor at Sick Kids, and I'm also the testing lead at Peel Public Health. Next slide. So today I'll be talking to you about testing, and then Dr. Gourtu will walk you through an update on vaccines. So without any further ado, we'll go to the next slide, please. Today we're going to be covering isolation guidance, questions about rapid antigen tests, assessment centers, and outpatient therapy. Next slide, please. This is a busy slide, and I want to emphasize that everything we present today is subject to change. There are constant updated guidance to testing and isolation periods. And so whatever I present to you today might be subject to change next week. So with that caveat, right now, the isolation guidance is as follows. So if you develop symptoms, fever, cough, shortness of breath, loss of taste and smell, the likelihood that you have COVID or Omicron is quite high. And then the guidance is, unless you qualify for testing, to self-isolate for a certain number of days. If you're fully vaccinated, you can self-isolate for 5 days, or if you're under 12 years old. And if you're unvaccinated or partially vaccinated, you should isolate for 10 days. So far, the guidance for fully vaccinated remains 2 doses. However, we know that 3 doses is best to prevent transmission and infection. We'll walk you through the slides, or we'll unpack the slide on the next slide. So next slide, please. So this is the isolation period for now. And so if you're fully vaccinated or under the age of 12, you only need to isolate for 5 days. That being said, for the other 5, we encourage you to wear well-fitted masks in all public settings and don't visit high-risk people in high-risk settings. So high-risk people include immunocompromised individuals, elderly individuals, and high-risk settings are really long-term care homes. So although your isolation period is a bit shorter if you're fully vaccinated, we do encourage you to maintain caution for a total of 10 days. And the guidance for unvaccinated or partially vaccinated individuals is to isolate for 10 days after the onset of symptoms. Next slide, please. The self-isolation period can be ended. So after you've done your 5 days, and you're wondering if it's safe to go back to work or school, in order to end that self-isolation period, it's not just simply completing the number of days. It also is having kind of improvement in your symptoms. And really we empower individuals to really make that decision on their own. And so you must not have a fever and your symptoms might be improving. You could still be fatigued, but your cough or cold or runny nose should be getting better. A cough we know can linger for many weeks after infection, but overall, if you're feeling better, you're feeling that you've improved, you can go back to your daily work. But for GI symptoms like vomiting and diarrhea, your symptoms should have improved for 48 hours. Next slide, please. This is a busy slide. And so what do you do if someone in your household has symptoms? How long should you self-isolate for? So I know the slides have been circulated, so it might be a lot of information to take in all at the same time, but you can read through these independently. So all household members with individuals with symptoms, regardless of vaccination status, should isolate with the infected individual. So even if you're fully vaccinated, if someone in your household has symptoms, you should isolate with them for 5 days if that's their isolation period, or 10 days. That being said, if other members of the household start to develop symptoms, they have to follow their own timeline. They isolate from 5 days or 10 days from their symptom onset. And all the lucky people in the household who never develop symptoms and who are healthy should continue to isolate until the last person in their household is done their isolation period. If you've previously tested positive on rapid antigen test or PCR testing in the past 90 days, you don't need to self-isolate. But again, we emphasize that we empower individuals to make that decision and really be the custodians of their own healthcare. If they're feeling better, but if they're not feeling well, they should exercise caution and isolate along with their family members. Next slide, please. So I've had a lot of people in the past ask me, well, what constitutes a close contact? And so anyone who's been in contact for at least 15 minutes without PPE closer than 2 meters is thought to be a close contact within 48 hours of symptom onset. So that's the short and quick definition of a close contact. But again, As I've emphasized in the past, all of this is subject to change as guidance might be loosening in the upcoming weeks or even as soon as next week. Next slide, please. Notifying close contacts. So if you feel that you have symptoms compatible with COVID, the responsible thing to do is to notify people with whom you've been in close contact in the past 48 hours. Next slide. And then again, what when we say you should self-isolate, it really means staying home, not going to work, avoiding the use of public transportation, and doing your best to stay away from others in your household. That being said, we know that with individuals with young children, that type of self-isolation might not be possible. Next slide. We'll quickly chat about testing before I hand you over to Dr. Gortu. And the testing eligibility was quite narrow. So you'll remember that in December, around December 31st, the eligibility for testing criteria became quite narrow to include patient-facing healthcare workers, individuals working in high-risk settings like long-term care homes, household members with high-risk staff. Next slide. Temporary foreign workers, pregnant individuals, individuals who are homeless, first responders, including fire, police, and paramedics, and individuals who had remaining PCR tests at school. Next slide, please. I was asked to speak about rapid antigen tests and their sensitivity and specificity and their likelihood of getting it right. The bottom line is that any test is as good as every test has its limitations. And the more COVID there is in society, the higher the likelihood that a test that's less sensitive or less accurate will get it right. And so the rapid antigen test works. I'm sure many of you have done it by detecting viral proteins. So you have to have enough virus in your nostrils or in your throat to be able to scrape off viral proteins that then get detected in the test. Next slide, please. It was thought that given the high burden of Omicron and COVID in the community, that a positive rapid antigen test was likely meant that the individual had COVID. And importantly, if you've tested positive on a rapid antigen test before, and you're wondering when you can start testing again, you can start testing 30 days after your initial infection. Next slide, please. So there's a number of clinical assessment centers. So I work in an emergency department, but there are a number of individuals who have COVID, cough, cold, and flu-like symptoms who simply want to be assessed and who have difficulty reaching their primary care providers. So I encourage you all to look at the province of Ontario's website and put in your postal code. And there's a number of community centers that will assess you if you have a fever, cough, cold, or if you want to be assessed. And that will help you avoid visiting the emergency department if you'd simply like to be assessed. But importantly, if you're having trouble breathing, or if you're having neck stiffness, if you're having chest pain, you should always go to the emergency department. Next slide, please. So there is a cough, cold, and flu clinic at 1 Elizabeth Street with the details on this slide, and you can book an appointment to be seen. And they'll see kids as older than 6 months of age. So if you really need to be assessed by a physician or healthcare provider but can't reach your own, this is a good alternative in the interim. Next slide, please. In some cases, there are outpatient therapies that are available for individuals who have symptoms within the first, so you're eligible for treatment if you develop symptoms in the first, or if you're within that early period of infection, 5 to 7 days of having symptoms, if you're immunocompromised and older. But all of those treatment options are really at the discretion of your provider. So if you're wondering if you qualify for treatment, you can go to the COVID assessment center that I showed you in the last slide to see if you're eligible. And without further ado, it is my utmost pleasure to introduce you to Dr. Gortu.
Thanks, Dr. Sundaji. I'm Dr. Rachita Gertu. So I'm a family doctor working in the Mississauga area. And over the last year, I've been working with Peel Public Health as one of the leads for their COVID-19 vaccination program. Next slide. So I just want to take a few moments just to talk about the COVID-19 vaccine and just review some of the eligibility and just some updates that have happened over the last little while. So as a reminder, vaccination remains one of the best ways to protect individuals against severe symptoms and hospitalization. I know there's a lot of questions about as things are opening and our vaccine passports, et cetera. There's a lot of changes coming, but just want to remind everyone that it still continues to be important. So if you or any of your family members, friends have not had the opportunity, really encourage you to come out and get your dose. Even though a large portion of residents in Peel have had their first and second doses, there may still be some individuals, particularly in our 5 to 11 age group, that have not had a chance to have their first and second doses. So just as a reminder, they continue to be eligible to come out and get their vaccine. It's recommended, so even though the product monographs, depending on which brand of vaccine you're getting, usually it's a 1-month interval between first and second doses, NACI and the Ministry of Health recommend that the dose, your first and second dose, the time between them be 8 weeks apart. And the reason behind that is that there's growing evidence to show that having that larger interval provides a better immune response that hopefully lasts a little longer. However, considering, some people may have medical reasons or other reasons why they wish to have that dose at the product monograph interval, they can do so with their consent. And then as a reminder, as many of you know, there are individuals now who are eligible to have their booster doses. So anyone age 12 and over now is able to get their booster dose. Just as a reminder, the purpose of the booster is that over time, even though individuals have had their first and second doses perhaps last year, over time we're finding that that immunity can wane, and that booster dose just kind of acts as a little, as it says, a boost to your immune system to help fight any possible infection that you may come across. So though 2 doses in the past were providing good protection against the previous variants, we've seen particularly with Omicron that you don't have that optimal protection, and that booster dose really is important to kind of give you that optimal protection again for severe illness and hospitalization. So particularly individuals aged 50 and over, or those with health conditions that may put them at higher risk of severe illness if they do get COVID infection, really encourage you, again, if you haven't, to come out to get your booster dose. So for individuals who are aged 18 and over, you're eligible to receive the booster dose 3 months or 84 days since your last dose. For individuals or youth that are aged 12 to 17, the recommended interval as per NACI and the Ministry of Health is actually 6 months or 168 days. And the reason for that slightly longer time period is that there may be a decreased risk of myocarditis, which is a rare but a possible risk after vaccination for this age group. So hopefully with having that prolonged or longer interval between their second and their third dose, minimizing that risk as much as possible. However, just as a reminder, there may be some youth in this age group where, due to other health conditions or personal reasons, there may be a greater benefit for them to receive their dose at an earlier time frame. And so with informed consent, they can receive it at a minimum of 3 months or 84 days, similar to adults over the age of 18. And just as a reminder, children between 5 and 11 are not eligible for a booster dose at this time. Next slide. Just wanted to quickly talk a little bit about special populations because the dosing and the doses required for these individuals are a little bit different. So in particular, immunocompromised individuals age 5 and over recommend to actually have 3 doses instead of the routine 2 doses for their primary series. And again, the rationale behind this is because some people, even though 2 doses may be sufficient to mount a good immune response for most individuals, some people in this immunocompromised group, which can include people who are, say, on active treatment for cancer, such as chemotherapy, or they're renal dialysis patients, or on medications that severely suppress their immune system. So they might be individuals on treatment, say, for rheumatoid arthritis, multiple sclerosis. Because your immune system is not maybe as strong, they need that 3 dose to mount a good response. So anyone who's age 5 and older now is eligible to have those series of 3 doses. And those that are now 12 and over now are eligible for their booster, which now actually becomes their 4th dose after that same interval as we talked about in the last slide. And if you or someone you know is eligible and are in that immunocompromised group, it's important to speak to your physician. You will be required to bring a referral form or a copy of your prescription of the immunocompromising medication so that our vaccination team knows which dose that you need, and making sure that the timing, the doses are given at the appropriate timing. it's really important for these individuals also to talk to their talk to their provider, just to make sure that the timing of when they receive their dose does not conflict with any other treatments that they may be receiving at this time. Just as another piece as well, other individuals that are receiving an extra dose, residents in long-term care, retirement homes, and seniors in eligible congregate settings. Again, because of the combination of having waning immunity over time, and also because of living in congregate settings, as we've seen, can put individuals at high risk of exposure and complications after they, if they do get a COVID-19 infection. It's recommended for these individuals. So it's the residents in these settings, not the workers, that are eligible for a fourth dose. And our vaccination teams are going out to these settings to help provide these doses, and some of the long-term care homes and retirement homes that their teams will be providing as well for their residents. Next slide. So just wanted to summarize where individuals can go to get vaccinated. So those of you living in the Caledon area would be able to come out to one of our Peel Public Health vaccination clinics. We do have some larger clinics, such as the Caledon East Community Complex, where the hours are Sunday to Thursday, and we are taking walk-ins as well, though we do encourage people to book an appointment, and you can do that through the provincial booking system. There are some smaller clinics as well, and some families may choose that environment as it's not as busy, and some kids find that a bit of a nicer environment as well. So there is one coming up actually tomorrow at St. Michael Catholic Secondary School, and that's after school, and we welcome families to come together. So and adults, if they have not received their dose and are eligible, can also receive their dose at the same time. We also are really privileged to have some great partners that are working with us. And so along with the OHT, we have the Caledon Center for Recreation and Wellness Walk-in Clinic as well, which some of you may be familiar with. And that's open on Fridays from 3 to 7 p.m. And lastly, there are many pharmacies as well as primary care providers that are providing vaccine as well. And you can check out our website, and there's some links there to help you find a location that's close to you. Next slide. I just wanted to provide a little bit of a reminder. I know this is a question that's coming up quite often that we're hearing in terms of when's the best time for a person to get their vaccine dose if they already had COVID. So the reason, just I guess in summary, having the infection provides a bit of a boost to your immunity. However, unfortunately, that immunity decreases over time, and it's variable for individuals depending on various factors such as how old they are, other health conditions they may have. So it's still really important to receive the vaccination, but NACI and the Ministry of Health have provided guidance on sort of the optimal timing to receive vaccination so that individuals can mount a stronger immune response once that natural immunity starts to wane. The way they define previous infection is that either you've had a positive test, so either a PCR test or a rapid antigen test, or you've had symptoms consistent with a COVID-19 infection and you have a household member that you've been exposed to and they have had a positive test or their positive case. So for someone who has not had their first or second doses or are between doses, the recommendation is to wait 8 weeks after your symptom onset or when you had a positive test for perhaps those that had no symptoms. If you're waiting to have your booster, so you've had your first and second doses and now you're waiting for, or you're eligible to get your booster, but had a COVID-19 infection in between, the recommendation is to wait 3 months after your symptom onset or your positive test until you receive your booster. Now, I know as Dr. Sundarji mentioned, you know, the criteria to get tested has changed recently. And so there were many people in December and January that had a COVID-19, well, had symptoms that could have been COVID-19, though unfortunately did not have access to testing. So for those that did not have a test, it's really hard to say whether or not it was a COVID infection. So as a reminder, you are eligible to be vaccinated once you've completed your isolation and you have improving symptoms. It's not essential that you have to wait these time periods in order to receive the vaccination, and there are no safety concerns for receiving the vaccine earlier than these intervals. So if you or someone you know does fall into that category, if you had symptoms or not really sure if it was COVID or not, I really encourage you to speak to your healthcare provider, to your physician, to have that discussion, to sort of weigh your options. And you can find some more information on our website as well about this. Next slide. So just lastly, just wanted to provide a little bit of an update in terms of other vaccines that are available in Peel for individuals who may be interested. So mRNA vaccines, or the Pfizer or Moderna vaccine, as we kind of have come to know them, still remain sort of the preferred vaccine in terms of their effectiveness to provide the best immune response against COVID-19. However, we do have viral vector vaccines that are continue to be available in Peel. So that would be the Janssen vaccine as well as the AstraZeneca vaccine, and they're available at select pharmacies in Peel. And you can check out our website if you wanted to find out more. As I mentioned, Nancy and the Ministry of Health continue to recommend that every effort really should be made to immunize with an mRNA vaccine. And the viral vector vaccine should only be used really if there is a medical contraindication for someone to receive an mRNA vaccine or someone declines to receive it. We're not using these vaccines as a booster at this time, except for those individuals who may have a documented medical contraindication to receiving an mRNA vaccine. Also, some of you may have heard that the Novavax vaccine has been approved by Health Canada. We are expecting that there will be some limited doses coming to Ontario sometime in mid-March, though we still are waiting for some more information. And since these slides were prepared, Medicago, another vaccine, has recently been approved by Health Canada as well. And again, we're waiting to hear more about when and to whom it will be available here in Ontario. The last thing that I just wanted to touch on as well is that we do have some residents that had their vaccinations overseas or in a different province outside of Ontario. If that applies to you or someone you know, really encouraging you to please upload your information or the vaccine report to our website so that we can log it into the vaccine system, so that if you still require proof of vaccination, that information can be validated and entered. So people, if they do need a QR code for any reason, though I know this is something that's going to be changing very soon, we can make sure that that information is input into the system for you. And again, if you do have any questions or any something that you need more information about, really encouraging you to check out our website, please, and some great links there for you to find out more. And I think that is all from our end. Thank you very much again for having us.
Well, a sincere thank you to you two for giving up part of your Sunday. You're busy people to start with and have a tremendous workload. So a very sincere thank you to Drs. Sunderji and Gertu. A reminder again to folks who are watching online, there was a lot of information that was presented. So if you need to go back to review it, which you're likely like me, it will be on the website and you can access this within the next few days. So thank you again very much, doctors. You are hereby relieved. You can go back and relax and enjoy your Sunday. So at this particular point, we're pleased to welcome our friends from the mental health community, Maureen Taggart, Tim Smith, and Catherine Hannenberg, who will be talking about taking care of mental health during this very stressful time. So thank you very much for the three of you for giving up your Sunday, and take it away.
Oh, thank you so very much, Bob. And truly, it's a pleasure for Tim and Catherine and I to be with you today, just to take some time to reflect on taking care of mental health, especially in these past 2 years of COVID-19. And next slide, we'd like to first kind of start with an image and really invite you to imagine that life, your life, is a journey. It's a journey on an ocean and you are the boat. And perhaps like many of us, you also have spent, time in your life trying to control the waves. And as COVID and perhaps other life events have taught us, we don't really control the waves. And if we try to prevent the waves, we can become exhausted, discouraged, depressed, fearful. We can perhaps even be resentful of others who seem to have a calmer ocean to travel on compared to maybe the waves that are, hitting us in our lives. And so, we want to invite you to consider that, perhaps what we learn through this journey that we live and have been living in these past 2 years is that instead of becoming maybe hopeless or feeling defeated over our lack of control of the waves, we can direct our attention instead and our energy towards the boat. And next slide. And in our efforts to do so, perhaps, really, pay attention to what we need to nurture ourselves, the boat, as we travel on and through, times that, that may be calmer and times that may be stormier. And, along the way, invite others to journey with us so that when we hit a wave, we do have a better chance of getting through it and maybe developing the hope, the skills, the resilience for future waves. And next slide. So again, for many of us, COVID has shone a spotlight on the challenges and importance of our mental health. While we've each been navigating experiences of uncertainty and isolation, sadness, loss, and maybe at other times, even relief, connection, and resilience. 2020, 2021, and now 2022 have been really challenging years. Next slide. And the impact, has been felt by all of us, perhaps to varying degrees, but certainly each of us have been affected. Next slide, please. So together in this time with you, we want to just share some ideas for shoring up our mental health for all of us, for youth, for adults, for seniors, for families. And in addition, we want to spotlight some of the Dufferin-Caledon mental health services, who we are, how to make a referral, and even, maybe focus in on some of the highlights from our last 2 years. And then lastly, we'll share some online and other resources, not exhaustive in any way, but maybe some things that are there and helpful to you taking care of your boat. If there's time, we'll take some questions and answers. And of course, you're welcome to put them in the chat box as we go along. So I'm going to turn this to Catherine now, who's going to get us started with considering how we shore up mental health.
Thanks, Maureen. Excuse me. The first area we're going to focus on is social supports and how COVID has impacted our social supports and what we can do. So our connection, we all know that social connection with friends and family is important for our mental health. However, over the last 2 years, we've lived with social distancing, isolation, virtual connections, and all of the challenges that brings. The effects of isolation are that our social skills may have gotten rusty, excuse me, just like muscles that are not used. We might feel awkward, anxious, angry, tired, irritable, sad, unable to manage. We used to feel ordinary. So our society, in addition, our society's become polarized and less tolerant of differing opinions. So what can we do? We need to, first of all, pay attention to our own capacity as we start to socialize again more broadly than we have been. We have to honor our own boundaries and those of other people. So practice being intentional with your social time. Reach out to connect with others, but pay attention to how much time, which people, how big a group, and how frequent socializing you are able to manage. Start with situations and people that feel more comfortable to you and build from there. You can block out time each day to do something small, something social, and it can be small. Prepare yourself for interactions with others who may disagree with you about masks, vaccines, whether to hug or shake hands, anything like that. I was speaking to my 88-year-old dad about this challenge recently, and I thought he summed it up in a memorable way. He said, they are your friends, even if they're idiots. And I think no matter what side of any issue we're on, we might have thought that at some time. So I want to focus on the they are your friends part. Be ready to take care of yourself and to step away and take a deep breath rather than arguing. Focus on the connection you have rather than the disconnection. So you can say something like, I care about you, but I'm not ready to hug yet. And remember to support your kids and others to help redevelop their social skills. Kids in particular have even less experience to draw on to navigate these challenges. And as we coach them, consider that we're also helping them to get those tools to navigate other pressures that they may encounter in their lives. And my little picture there is about how awkward it can all feel. So thank you. And on to Tim.
Great, thank you, Catherine. As you can see, we want to look at the different aspects of our lives that may impact our mental health. And so I want to speak to you at this point a little bit about our physical health and how that correlates with our mental health. We know through research that there's a very strong connection between our physical and mental health. And many folks have heard of a runner's high, an emotional state arrived at by physical activity. This is one example of a connection between our physical and mental health, but we don't need to all go out and start jogging 50 kilometers to still benefit our mental health with physical activity. The impact of the pandemic on our health has been significant. Early on in the pandemic, people were doing more cooking, making bread at home, and getting out less when we really felt we had to stay at home. The result for some, and I will put my own hand up here, is that we may have put on a little bit of weight, the COVID-19, you might call it, similar to the experience of college students that sometimes gain a freshman 15 when they start university. Some of us have changed our eating habits over the last couple of years, leading to an increase in weight. At the same time, we've lost the opportunity to play sports up until fairly recently, attend the gym, go to yoga classes or to Zumba, and for many, lose the opportunity to remain active. Now, these are changing certainly in the next couple of days, which is wonderful, but the impact is still there on us now. Many of us need to see more of those participation commercials that we used to see on TV to remind us of the importance of regular exercise. Working towards a regular physical health routine helps our mental health. It's not just the physical activity, but it's also the need to be mindful and purposeful with our health and in establishing and keeping healthy routines. As with any aspect of your mental health, speaking with your family doctor about how physical activity can help your mental health is a really great idea. Keeping with the physical activity and sports theme, we like to think of your family doctor as a quarterback of your healthcare team. So we always encourage folks to speak to their doctor when considering how to improve their health. Next slide, please. The emotional experience of the pandemic has really been quite significant. We've ridden on the highs of the waves of the pandemic and also crashed in the low. Many of us have experienced a significant reduction in our sense of control, and much like the graphic on the slide, it sometimes feels like a roll of the dice in terms of how to manage the waves of the pandemic. This is normal. Nobody should feel bad about feeling those highs or lows or having some challenges sometimes with dealing with so much that we can't control. We all manage differently and sometimes not in the best way. In these times of emotional instability, we benefit from using the skills we've counted on in the past. For some folks, it's reading or going for a walk. Other people like practicing meditation or sometimes just having a nap. Doing the things that you know will ease your stress and allow us to carry on is necessary and it's healthy. You can also try new skills, including mindfulness activities, deep breathing, or other stress reduction techniques. Remember that to get comfortable with any new skill will take some practice, and you need to find the one that feel right to you. Practicing skills to reduce stress allows us to feel more control and to have more energy to deal with the challenges of the day. And now I'd like to pass it back to Maureen.
Thank you, Tim. And next slide, please. So just as taking care of our social selves, our physical and emotional aspects of ourselves, our boat, so too is the importance of taking care of our thoughts. And I would suggest doing so with self-compassion. In particular, I think we could say that these past couple of years for many of us have been an anxious time. And when we think about anxiety in many ways, it presents, and COVID itself has presented the essential ingredients for anxiety, that sense that threat is high and our ability to cope is low. And so, what can any of us do as we look after our boats during this time? I really would suggest to you that we can draw on our curiosity, our kindly curiosity towards ourselves, to begin to challenge our worries and our anxious thoughts. One strategy or exercise, which is highlighted in some of the resources at the end, is an exercise called the worry decision tree, which really invites us to take a look at, whether the anxiety, the worry that we have at a given time, a given day, a given moment is a real problem to here and now or hypothetical. Both matter, but with doing that, if it's a real problem here and now, there may be some things that we can do about it. If it's hypothetical, some other ways in which we can approach it. We can start by noticing some of those thoughts that start with a what if, and bring these kindly, compassionate questions to mind to say, is this true? Is this thought helpful? Is there a more hopeful way? What do I need in this moment that can help me to feel, safer and more grounded? And so in addition to thoughts, next slide, please. Another part of taking care of our boats is also looking after our spiritual selves. And that may mean many different things for any one of us. For some of us, that may have been, over these past couple of years, practices related to prayer or meditation, as Tim suggested as he talked about mindfulness, or other faith practices, or being connected to faith communities, or being out in nature, a walk for the woods, just really making space for some of the sacred in our lives. So looking after ourselves, taking care of our boat, can draw on many different things to help us manage some of these waves of life in terms of our social connections, our physical and emotional health, our thoughts, and perhaps our spiritual practices. What we'd like now to do is to talk a little bit about some of the resources within our community. And I'm going to pass this over to Catherine and ask for the next slide.
Excuse me. So I work at Dufferin-Caledon Family Services, and I manage the Child Youth Mental Health service there. We serve both Orangeville and Dufferin counties. We, as well at DCAS, we have child protection services, developmental services, but I'm focusing on the mental health part for children, youth, and families. Those services can all be reached at our phone number, 519-941-1530. In addition to our services, we're part of the Dufferin-Caledon Integrated Crisis Network. We provide phone and community support 24 hours a day for children, youth, and families. And Tim's going to talk a little bit more about crisis services, but it can be anything. It's not just like anything that feels very overwhelming in the moment where someone needs some support. In addition, during COVID, we introduced phone and virtual talk-in counseling as the door to all of our services. So we do still see people in person, but for that initial talk-in session, we ask people to book through our online portal, through our website. Right at the top of the page, there's a button that says book appointment. And that very quickly can lead to booking an appointment where someone can come in and start that process of figuring out what supports might be appropriate going forward. Thanks. I'm going to turn it over to Tim.
Thank you again, Catherine. So I work with CMHA Peel Dufferin, and I've been working in the Dufferin community for about 20 years. The interesting thing is I've never switched employers, but we switched names of our agency 4 times in the last 20 years. So some folks that have been in the area for a while might remember the Community Mental Health Clinic, or Trellis Mental Health and Developmental Services, and then on to CMHA Waterloo Wellington Dufferin. As of 2016, we became part of CMHA Peel to create CMHA Peel Dufferin. So we've had good services in our community for a long time, and we are just one of them. What I'd like to share with you today, though, is a reminder that we do have 24-hour crisis line available, 24/7 crisis supports Peel Dufferin. Excuse me, at the number you can see on the screen. And there will be somebody to answer your phone call whenever you need them. The other wonderful part of our crisis service is that we have an adult crisis worker in the community, 10 a.m. to 10 p.m. every single day, 7 days a week. So if you require assistance at home, in the community, if you connect with crisis, they can help arrange a mobile visit between 10 and 10. As Catherine mentioned, we have a Dufferin-Caledon Integrated Crisis Network, which is a partnership of agencies that provide crisis services, including ourselves, DCAFs, FTP, and the hospital. And we would like to make sure that regardless of which front door somebody uses, they never get missed. And we always are connecting to make sure we provide the best service we can as somebody might move through the mental health system. CMHA Peel Dufferin, of course, is focusing on adults and seniors in terms of mental health and addiction services. And one of the things that we are really, really proud of is that at the very start of the pandemic in April of 2020, it's not that long, it just feels like it's that long. We started offering single session counseling, which is something we hadn't done before. Folks were able to call in and book an appointment, usually within 24 to 48 hours, and speak to somebody to deal with whatever concern or issue they wanted to speak about. And that's something that we have continued since the start of the pandemic. And in fact, given that it has been quite popular and a good use of our resources, we will be continuing this post-pandemic and part of our regular suite of services at CMHA Peel Dufferin.
Tim, I just wanted to mention that we are coming up on 2 minutes. If we could start to wrap up, thanks.
Thank you very much, Bob. Absolutely. Maureen, I think you've got the next slide.
Thanks, Tim. And then, of course, also, one of the providers for adult, older youth and adult mental health counseling services in our community is the Dufferin Area Family Health Team. And through our mental health program, we provide both individual as well as some group counseling. We also offer 2 weekly single session clinics and really focus in on coming alongside folks who are dealing with anxiety, depression, loss, stress, or a variety of other life struggles. The referral process is simple. It may be either initiated by the patient themselves or made by their physician. And our phone number is up there. Our intake extension, dedicated intake extension, is 330. And we work with DAFT, rostered, and Bolton Faux patients. Also wanted to highlight, a couple of things that we did during COVID-19, not only in continuing to provide individual counseling services, we've also introduced a couple of Zoom groups that were really well received by folks who participated. One was a group called Overcoming Worry, which was a cognitive behavioral therapy group, and a social support group called Tea Time for dominantly women who were maybe dealing with some of the isolation and loneliness during this time. In addition to our services, next slide, please. There are certainly some other services in the community we wanted to quickly highlight. Family Transition Place for the work that they've been doing with women and children dealing with abuse and trauma in their lives, as well as men who are sexual abuse survivors. Hospice Dufferin for really coming alongside folks dealing with life-threatening illness and or grief support, bereavement support, and SHIP for the work that they've been doing in providing case management, housing support, and counseling for individuals with other more significant mental health concerns. and then to Tim for some online resources.
And very quickly, because Bob, I can see you're looking at me with the time's up face. There are great resources online. These are some that we have used and shared with folks that we support, so we can back them up and say that they're quite useful. More stuff online than ever before. So great place to start if you have questions about your mental health or resources. And we'd always encourage you to ask the questions, check in with your family doc, speak with friends. It's an important topic that is good for all of us to speak about.
So thank you very much for having us here today. And again, we invite you to join us as we all try to take care of our boats during this time, which has been so challenging and still has challenges ahead.
Well, a special thank you to you, to Maureen, Tim, and Catherine. Very much thank you for a great presentation. And again, to everybody, the resources again will be stored online on our website. And so at this point, we're actually going to put you to work. Heidi is going to introduce our first set of polling questions.
Yes, you probably didn't realize it's going to be slightly interactive here. So this is just a quick question that we would just like you to provide feedback on. It is anonymous, so we will not know who has answered what to the question, but hoping that you guys can all see this. The question is, if you were to rate your own mental health over the past month, with 1 means it needs a lot more attention and 5 is super great, doing really well, how would you describe your current mental and emotional well-being? And keeping in mind the past 2 years in particular. So if you can just take a moment to answer that question. So 1 is you need a lot more attention, 5 is super, doing really well, and 2, 3, 4 would be somewhere in the middle there. I'm just going to give another second. We don't quite have everybody answered just yet. Okay, I think I'll end it there, and then I will share the screen with you so you can see the results, which are actually quite interesting. So a great percentage of you folks are actually feeling, between the 3 and 4s, not too many in the 1s, which is nice to see, but not a whole lot in super great either. So we definitely do have some room to spend some time focusing ourselves and improving our mental health and spiritual, physical health, as we discussed. So thank you for participating in that.
Thanks, Heidi. And now it's time to move on to our next presentation on advanced care planning. And we're thrilled to welcome Natalie Talma, who is from the Bethel Hospice. Welcome, Natalie. It's all yours.
Thank you so much, Bob. So let me preface this with, this is a topic of conversation that I could spend a couple hours talking about and educating all of you on, but this is going to be a very brief overview, but there are some resources at the end of the presentation, so rest assured that you can access all of the information later on, and you can certainly follow up with me at your convenience to answer any other questions or concerns that you might have. But I'm absolutely thrilled that I was invited to speak to you today. I'm going to start with a really personal reflection. So although I talk about advanced care planning professionally day in and day out, the real reason behind my passion for advanced care planning is really because I personally know that anything can happen at any time. And so you can see, this was several years ago, but had a gastric tube in. I almost lost my life when my bowel perforated suddenly. I don't remember a lot of it, to be honest. I was in and out of consciousness, but I do remember hearing in my peripheral that I could hear the doctors talking to my parents, who were my substitute decision makers at the time, saying, we don't know if she's going to make it, and what do you want us to do? And although in that moment I couldn't really appreciate the magnitude of the seriousness of that, when I healed and am now well, I've spent a lot of time reflecting on how horrific that probably was for my parents to be in a position where they were suddenly needing to make decisions about my life and my death, and not having had any previous conversations about what my wishes, values, and beliefs were. And so since that time, I've spent a lot of time thinking about what is important to me. And if my health were to suddenly decline again, and I was not able to speak for myself, what is it that I want my loved ones who are going to be making those decisions to know, so that they can feel confident in the decisions that they would be making? And so in that way, I feel like advanced care planning is truly a gift to those that you love. And that's really the message for today. So next slide, please. So what is advanced care planning, and why advanced care planning matters? So first of all, why it matters is, like I said, anything can happen at any time. So it's good to be prepared. Also, when you are participating in thinking about what's important to you about your life and your death, it's important to think about those things when you're not in crisis. And so you can come up with a plan that is more thorough and thoughtful when you're not thinking about, when you're not making those decisions in the context of a crisis. It also allows you to stay in the present. It allows you to do it and then shelf it, so that you can focus on the present with the knowledge and comfort of knowing that you've planned ahead. It also ensures that you're cared for in the way that you want and are comfortable with. As I mentioned, it can absolutely decrease caregiver distress and trauma by avoiding the immense distress that can be put on family members when they're put in a position to make decisions when they don't know what that person would want. It can also decrease unwanted investigations and interventions and treatments. And folks are also less likely to be hospitalized and admitted to critical care, and to die in a preferred setting with earlier palliative care involvement by participating in advanced care planning. So what exactly is it? Advanced care planning is really, at its core, a process of reflection and communication. It involves considering what your wishes, values, and beliefs for your own health and wellness are, identifying the person that will be making decisions on your behalf is, if you're not able to, and then relaying the information about what's important to you to that person so they can act on your behalf if and when needed. Advanced care planning is not consent for treatment. It's really about living well, helping you to feel confident that you will be cared for in the way that you want to, and that your wishes will be followed through, even when you're not actively able to say what you want. It doesn't require any cost. Anyone can do it, and you can start at any time. So 5 simple steps to refer back to. The first one is really, step 1 is to think. So I challenge you to do a bit of homework after this to really think about what are your goals. When you think about your health and wellness, and if something were to change for you, what would your goals be? You know, what are your biggest fears and worries? For example, when I ask some of my clients that question, they may say to me, my biggest fear is being in pain. You know, I have a very low pain tolerance and I don't want to die in pain, or I don't want to suffer, and suffering equals pain for them. Other people may say that their biggest fear or worry is to be alone when they're unwell. I also want you to think about what gives you strength. So some people, when I ask that question, will say that being in the presence of people that they love gives them strength. Other people will tell me that their faith gives them strength. I also challenge you to think about what abilities could you not live without? Think about what brings your life purpose and meaning, and think about some of the trade-offs that you're willing to make. So for example, I have a client right now, we've been engaging in advanced care planning. And when I asked him, what are some of your abilities that you could not live without? What is quality of life for you? And he was very clear that being able to get up and walk around and be independently, being able to independently walk around, he's a previous marathon runner, that for him was quality of life. Other people, when I've asked them what trade-offs are you willing to make, they'll say, you know, although I'm anxious about being in pain, I don't want to be in pain, I'm willing to tolerate some pain if it means that I'm alert and able to communicate with my family. So step one is to think. Step two is to learn. So most of us don't spend much time thinking about all of these different medical procedures unless they're on the table, right? Unless there's something that we need to be thinking about in that moment. But what I would encourage you to do is to spend some time when you're doing advanced care planning, learning about procedures like CPR, about artificial breathing, feeding tubes, hydration, antibiotics. Learn about what these procedures can do and what they can't do. So you have a realistic understanding of what they can and can't do and what you're comfortable with. I've worked in long-term care for a number of years, and I remember most families and residents when they came in would say, I'm a full code, which means they want you to do CPR if their heart or breathing was to stop. And we did a lot of education around that, not to persuade people to change their minds, but so that they understood what CPR can and can't do. And for example, in an older population, CPR is often not effective. You know, it can in fact lead to further complications like cracking ribs, puncturing a lung. And it often, even if it's able to restart the heart, it's very likely actually not to return somebody in an older age like that who has other challenges to the state that they were prior to CPR being performed. So this is the kind of information that I think is important to think about and learn about when you're engaging in advanced care planning. And then step three is to decide. So I'd be curious, we're not going to do a poll for the interest of time, but I would be really curious to find out how many of you actually know who your substitute decision maker is. This is the substitute decision maker hierarchy. So everyone does have an SDM by default according to this hierarchy. So spend some time afterwards taking a look at this. You can Google SDM hierarchy as well and find out who your SDM is. If you're not content with who that person is, then consider making what we call a power of attorney for personal care. And then next slide, please. These are just some of the things, and again, for the interest of time, I'm going to go quickly through these, but these are the types of things to consider when you're thinking about who you might appoint as a power of attorney. So things like an SDM, a person has to be at least 16 years of age. They, of course, must be available. They need to consent to being a power of attorney. There's also some bullets there of traits of a good substitute decision maker. So you want someone that you know that you can trust to make your decisions, to follow through, that's calm in a crisis, et cetera, et cetera. And then step 4 is to talk. So this can be a tricky one, and there's some really great conversation guides. I know I've sent Heidi some other handouts. You can also access it in the following slides. There's some resources that you can refer back to. This is often a challenging piece. We can often do the insight on our own, but then when it's time to share with our families about what's important to us, that can be a hard conversation to start. So there's a few ways to start the conversation that I've put there for you. For example, even later tonight over dinner, I'd challenge you to say, I was at a workshop today and I'd like to share some of the information that I learned with you, and then talk about advanced care planning. Or, I was thinking about what happened to Sally and her family. And it made me realize that it's important for us to also have conversations. It's important to note that when you're having these conversations with your family, I'd like you to refer back to the things that you considered in step 1. So your goals, these are the things to relay to your family. Your goals, your fears, what gives you strength, what trade-offs. These are the things that they need to understand in order to better make those decisions for you. And then step 5 is to do some recording. So again, as I said at the beginning, advanced care planning doesn't necessarily need to be written down. It's really about reflection and communicating with the people that are making decisions for you. But there are a few things that you can do to record if you want to. So for example, if you're not happy with who your substitute decision maker is according to the hierarchy, you can create something called a power of attorney for personal care and property. It's an easy document that you find online. I think I even shared it out in the resource section. You don't need a lawyer to help you fill it out. You just need some independent witnesses. It doesn't cost anything, very easy to do. You can also consider making a will. So people will often ask me, well, what's the difference between a power of attorney document and a will? A power of attorney for personal care has to do with when you are still alive and not able to participate in decisions on your behalf, whereas a will comes into play, a will comes into play, or an executor of a will when you've passed away. And then funeral arrangements as well. I know a lot of people don't like to talk about funeral arrangements, but the reality is when that time comes, it can be a true gift to your family if these kinds of decisions have already been made. Perhaps they've even been paid for, plans have been paid for. They are going to be grieving and in distress enough. And so if there are things that you can help to participate in that will make that easier, I think that that's a lovely thing. And then next slide, please. So there's a few other things, again, this is a very, very brief overview, but I wanted to put this into because I often talk with folks about legacy work. So this is what I call beyond the 5 steps. Legacy work, I think, can be considered a part of advanced care planning. Legacy work really is helping you to create something meaningful for the people that you love and care about. It can be activities that can help you feel connected to one another, even when you're physically apart, and can bring comfort to those that are dealing with chronic illness and their loved ones. I'll just give you a quick example. I'm working with a gentleman right now who we know that his prognosis is, a couple of years. He's got young kids. He wants his son to know how to change a tire. He wants his son how to, to know, and his daughters how to, change the filters, on the furnace at home. So he's actually making videos. And I just think that's such an awesome thing. So he's done the will, he's done the funeral arrangements. Now it's about what else does he find? What's bringing him purpose and meaning right now as he's preparing for that end of his life? And knowing that his kids will have these skills is something that's very meaningful for him and bringing him a great deal of comfort. So I absolutely include legacy work as part of advanced care planning.
Natalie, I wonder if you could wrap up in a couple of minutes, please.
Absolutely. Yep.
Thank you.
I'm on, I think, the last slide. So just, so really when people say, well, when should I do it? Well, you should do it right now. There really is no reason to wait. I'm in my 30s. I did this. I bought a cremation plot and I've done a will and I have a power of attorney. I did that years ago. And again, it's because anything can happen at any time. So I think it's not just for those that are in older age or are unwell. This is about thinking about what you want and preparing ahead so that you can shelf that and focus on the present. And I want to just say too, some people will say to me that, if I talk about death, it will bring it on. And I feel like, although it's maybe a crash statement to make, talking about it is not going to prevent us from dying, because the reality is that everybody is going to die. And so I think that we need to get our heads out of the sand, to be frank, at times, and we need to start having these conversations, because I think that it can really enhance quality of life for everyone. And so just a quick, the next 2 slides, there's online resources that I've listed here that you can refer back to. And then the next slide is about handouts. I have sent them to Heidi. I'm not sure if they will get circulated out. Heidi's nodding, so those will get circulated out. And again, quick Google search. All of this information is online as well. You can find all of these tools, the Speak Up booklet, the Power of Attorney booklet, all of that is free online. And if you need any support from Bethel Hospice, this is what myself and my colleagues do day in and day out. So feel free to connect with myself, make a self-referral, and hopefully we can help guide you through that process as well. So thank you so much for your time. I know that that was incredibly fast and brief, but hopefully it's triggered something in you to make that decision to look into it a little bit more and do something good for yourself and for your family. Thanks so much.
Thank you very much, Natalie. And we really appreciate the fact that you really rushed through a very important topic. And again, I would remind everybody that all this information will be online. And so Heidi's going to put you to work for a second time.
Yep, just a really quick, easy question. Do you currently have an advanced care plan, or have at least started the conversation, the process that Natalie was speaking about? Yes or no? Okay, it's still computing. I think that's probably good. Okay, I'm a little surprised and very happy to see this. 69% have started the conversation at least and have a plan. So that's great. I think that's great. I wasn't expecting it to be that high. So I think that's awesome that you guys have done that. Thank you.
Thanks, Heidi. Again, it's my pleasure to, at this point, invite Alex Lim. Alex is the transformation lead of our Ontario Health team currently. And so I'm going to invite Alex to spend the next 10 minutes with you. Take it away, Alex.
Thanks, Bob. I'd also like to introduce Leanne Barber, who is one of the 2 co-chairs of our Hills of Headwaters Collaborative OHT, and she will provide some opening remarks before I dive in.
Good afternoon, everyone. Thanks very much. And thank you to all of you for coming out this afternoon. It's really great to hear from all of the community partners and the great work that's happening. But most importantly, we want to get the message out, and we need more folks like yourselves in the community to hear the messages that we're trying to deliver and share the word about the great things happening here in the Hills of Headwaters. Next slide, please. Great. So just some of you may have seen this slide before, and this is our tree diagram that really outlines what the Hills of Headwaters Collaborative OHT is here to do. Our vision really is to create one community that works together to improve the health and well-being of those who live and provide care across Dufferin-Caledon. Our priorities for this past fiscal year and moving on into the next year really focus around some of the really important pieces you've already heard about this afternoon around the mental health and addiction services, making sure that we are expanding access to those and improving care. As well, creating an integrated palliative care team that will expand and improve care as well, and will ensure that everyone who decides to live out their final years and days in Dufferin-Caledon is linked with a physician to support them and a team of providers that will wrap around them. What you're going to hear about soon is around our crucial Caregivers in the Hills program. And really, like everyone else, we've had to pivot our work to support the response to COVID-19. And Alex is going to tell you a little bit more about that in a few moments.
Thanks,
I'll
Leanne.
turn over to Alex.
Wonderful, thank you. So I'll just go over some quick highlights from the past year in terms of some of the great achievements that we've been able to deliver. On the mental health and addictions front, although it is still in the early days of the Hills of Headwaters Collaborative, we have already started to receive a lot of recognition for our work in mental health supports. Recognizing that the pandemic was causing significant stress and loss, members of our collaborative launched the Mental Health and Addictions Community Response Working Group to identify and initiate creative, simple, and effective ways to support frontline workers' mental health. Using online and virtual tools, the Mental Health and Addictions Community Response Working Group developed an online booking portal for counseling, provided access to community self-care webinars, and psychological PPE for healthcare staff. A virtual recognition event and a Remembrance Day at a local nursing home mourning the loss of residents helped to acknowledge the work, challenges, and impacts of the pandemic on the community. The pandemic has placed enormous pressures on frontline workers. The level of engagement required to develop these mental health initiatives demonstrates the enormous spirit of collaboration among health and social services in Dufferin-Caledon. As a collaborative, we will continue to ensure vital mental health supports are available to those working in healthcare and living in the community to help them stay strong. So we are right now in the process of refreshing our vision for integrated crisis response in Dufferin-Caledon and developing a centralized intake form for mental health and addiction services with a common goal to establish a low barrier form for service providers and service recipients to engage with mental health and addiction services in Dufferin-Caledon. Next slide, please. On the palliative front, the Palliative Care Working Group has recently created several videos that can help answer questions during one of the most difficult times of life. Topics include palliative care, advanced care planning, which you've just heard about, and medical assistance in dying. Each video deals with the subject matter and with empathy and provides useful information aimed at the general public. These videos can now be found online on our website. In November, we also held an advanced care planning workshop for the Community Wellness Council core group and have plans to expand these workshops into the community at large virtually. Next slide, please. The Caregivers in the Hills program, which you will hear about shortly, is a program we are enormously pleased to have launched. This is the first of its kind community-driven caregiver program in Ontario, which has the goal of identifying caregivers in Dufferin-Caledon in order to validate and recognize their role in assisting with the care of their loved ones. In 2021, we completed the first two phases of the project, initially working with a few OHT partners to pilot the program and really expand it. As of 2022, we have entered phase 3 and have opened up the program to all unpaid caregivers across Caledon. Dufferin-Caledon. We now have 45 members enrolled and are in the process of onboarding local businesses to provide perks to our members. The program provides excellent resources and support for unpaid caregivers and is easy to join. Please visit caregiversinthehills.ca for more information and to sign up. Next slide, please. So throughout the pandemic, there has been a significant demand for assessment, testing, and vaccinations. We have helped to meet that demand through our integrated COVID response site in Bolton and the Dufferin-Caledon COVID-19 cold and flu clinic. The physicians, nurse practitioners, nurses, administrative staff, and many volunteers have made it possible for the clinics to shift, scale up, and respond to the needs of the community over and over again. This was particularly true with the rapid rise of the Omicron variant and the provincial push to deliver third dose vaccine boosters, as well as during the first and second doses as well. I want to personally thank everyone who gave up their nights, weekends, and particularly their holiday time to meet the extraordinary demand in December and January. I would also like to acknowledge the in-kind support of our many OHT partners, including the Dufferin-Caledon Physician Association and primary care physicians, Home and Community Care Support Services, Central West, the Dufferin Area Family Health Team, the Town of Caledon and the Region of Peel, Caledon Meals on Wheels, Caledon Community Services, Headwaters Healthcare Center, and Services and Housing in the province. The response and commitment of our partners demonstrated again and again that we can achieve anything as a collaborative. Also wanted to call out the Dufferin-Caledon COVID-19 cold and flu clinic. So this clinic has met the challenge of significant demand for assessment and testing, especially during the last quarter. It continues to operate Monday to Thursday during the evenings out of the Orangeville Family Medical Center, where physicians and nurse practitioners conduct assessments and complete swabs. Back over to you, Leanne.
Thanks, Alex. Next slide, please. So looking ahead, as we begin to shift from the pandemic response to system recovery, our Ontario Health team will continue to work closely with community partners and providers to ensure that patients and clients are better able to access and receive care closer to home. As we have learned through the pandemic, we are stronger and better together. The role of our Community Wellness Council represents the voices of our community and is key to the success of this Ontario Health team. We ask for your continued guidance as our community to help us as we move toward recovery and renewal. We hope that you will consider joining our Community Wellness Council. In our acronym world, we call it the CWC, to represent your family, your neighbors, and community in critical decisions and prioritizing our next steps. Thank you.
Thanks very much, Leanne and Alex. That's wonderful. Heidi, I don't believe we've got a poll, right? Nothing? Okay. So that takes us down to our last presentation. And Alex and Leanne both talked about our Caregivers in the Hills program, and I'm thrilled to introduce our program support lead, Deanie. Deanie, take it away for the next 10 minutes.
All right, thanks, Bob, and thanks everyone for hanging on here. So Caregivers in the Hills, you might wonder, what is this? Everyone's been talking about it. It's the first program of its kind serving unpaid caregivers in Dufferin County and Caledon. And it was conceived by our CWC, our Community Wellness Council. They identified it as a #1 priority back in 2020, and we got set right to work. So our aim is to promote positive partnerships between unpaid caregivers and the healthcare community to ensure mutual respect, communication, and compassion. Who are unpaid caregivers? Unpaid caregivers include any individual providing care for a loved one without receiving pay. Unpaid caregivers may care for a spouse or a partner, parent, child, a sibling, friend, or even a neighbor. At times, parents who care for children with higher needs may not consider themselves caregivers, but they absolutely are. And unpaid caregivers may also include teens or young adolescents who care for siblings with higher needs, a parent who is ill, or perhaps even a parent that may require assistance with language translation. How are unpaid caregivers identified? Well, during the first year of our program, we identified caregivers using 2 local organizations, the Alzheimer's Society of Dufferin County and Dufferin Child and Family Services. And as of January of this year, we've opened up the program to include all unpaid caregivers in Dufferin County and Caledon. So now if you're an unpaid caregiver, you don't require a referral to come and join our program. You can just go online and sign up or give me a call and I'll have that information for you soon. So we get asked a lot if there's an age requirement to be a member, and the answer is no, there is no age requirement. We understand unpaid caregivers come in all ages, all ethnicities, and cultural backgrounds. There is no cost to be a member. It's absolutely free. And we also get asked often if the caregiver has to live in Dufferin County or Caledon. The answer to that is no as well. We now have caregivers in London, even Ontario. As long as you care for someone within Dufferin County and Caledon who receives healthcare or supports here, then you are free to apply to our program. And so another question we get asked a lot is, what are the benefits of being a member? Well, the most important benefit is that you will receive a badge with your own photo and your name and our Caregivers in the Hills emblem. And you'll be recognized and validated for your role by healthcare providers and be involved in the decision-making process regarding care of loved ones. So it doesn't take the place of a power of attorney, but it does help you to be part of the conversation when it comes to your loved one's care. Our members note that having to explain their role repeatedly in health and social care settings has become really stressful, especially when their loved ones don't have a visible physical advantage. So the badge is intended to speak for you in this department, and it's intended to help. In case of an emergency, we also provide an attention card that identifies an individual as a caregiver, and the card can be placed in your car or your purse or wallet. Local businesses are also showing their support for our members, and they're offering our members programs and discounts at within Orangeville, Caledon, Shelburne, Grand Valley, and the surrounding area. So this way your badge isn't just valid in healthcare settings, but also within the community. So you can wear your badge when you're out and about. We also hand deliver gifts to our caregivers on Caregiver Appreciation Day, which happens every April. And we're always so happy to go ahead and do that and meet our caregivers face to face as safely as possible. And really, I'd say another benefit of being part of the First Caregiver program is our members provide us with information about their role so that we may better promote the necessity of increased supports to help them in their role. In other words, the more I learn and the more we all learn about caregivers, the better we are in terms of showing compassion and care for their role and the stresses of their role. And the better we can help advocate for more supports that will be directly benefiting caregivers. So next slide, please, Heidi. All right. So to learn more about the program and to apply, you can fill out our application online at caregiversinthehills.ca. You can also apply by phone at 519-216-6671, or you can email me directly at caregiver, no S, caregiver@hillsofheadwaterscollaborative.ca. So we try to make it as accessible as possible. And I just reading one of the comments, Natalie says, I love this program. Congratulations on leading the way in recognizing caregivers, supporting them in their role and showing appreciation and value for the work they do. Well done, team. Thank you. We are so proud of this program, and we're just thrilled to welcome more and more of you. We know that you do care for your family members and friends and neighbors. So we're happy to be here to support you. And that's it for me. Thanks, Bob.
Thank you, Deanie. That was marvelous, short, sweet, to the point. Again, we are thrilled to have Deanie running the program on behalf of the CWC, and just thrilled at its growing success. So we have one second last piece of homework for you on Heidi's going to put up a polling question.
Yep, and it's a really simple, basic one. Having heard Deanie talk about what an unpaid caregiver is, are you an unpaid caregiver? Yes or no? Okay, I think I'll close it now. So interesting, I'll share the results. Only 23% said that they are an unpaid caregiver and 77% said they are not. Thanks for answering, everybody.
Thank you, Heidi. And, you know, a program like today just doesn't happen without the hard work by a team of dedicated individuals, most of whom are unpaid community volunteers. In addition to the names that you see on the screen, I'd like to thank my co-chair, my partner, Heidi Vanderhorst, who you have met throughout. Heidi keeps the CWC core in line and on task, and we couldn't have done this particular presentation without her work. I'd also like to thank Cynthia Lacroix and Carmela Farah, our communication leads for our OHT, who helped us with print, social media, and radio ads. And Heidi, just out of curiosity, how many people do we have online today?
At the most, we had 48.
That's wonderful.
Mhm.
No, we just need to keep growing it. I'd also, before we move on, I'd also like to recognize and thank our 2 sign language translators, Jennifer Toval and Andrew Ellis. I don't know how you do it, folks, but it's been absolutely amazing, and we're thrilled to have you aboard, and we'll be certain to have you back again as we move forward in the future. So thank you. So we have one final survey for you to do. Here we go. Oh, yes. This one, the CWC will only be as strong as and effective as in our mission to safeguard and improve our local healthcare system if enough people get interested and involved. On the right-hand side of this slide, you'll find our web address, and it's been mentioned a number of times. And I think Cynthia will likely put it into the chat box. Please be sure to visit it, explore what's there for you. Don't hesitate to leave us a message, and we do monitor it regularly, and we will respond. So again, I mentioned before we say our final goodbye, we would encourage you to please visit the website posted on the screen. Someone has posted this into the chat box, either Heidi or Cynthia, so you don't need to memorize it. Your feedback is vital to help us provide a clearer picture of our community's perspective. We would love to have your feedback. That's what it says. So again, thank you for joining us today. Stay safe, stay well, and stay connected. Goodbye. Heidi, do you want to talk or not afterwards? Oh,
I was still on mute.
okay.